advice and providing us our co-chair. Okay, thank you very much for what all you've done. Okay, our second speaker is Susanne Stormer of Novo Nordisk. She is the Vice President and Chief Sustainability Officer. Let me also tell you, I heard her speak at the UN this morning. I think you're in for quite a treat. She's going to explain, hopefully once again, how you can really work with a CEO to get things done. Thank you.
Well, thank you so much. And I have to say, you noticed that I had to step down from the panel. It's because not only do I know, of course, that Gary is a hard act to follow, but I hadn't prepared well enough because I hadn't managed to check whether or not this was a slide-free zone or not. So now I brought some slides, and at least you can, if you don't want to listen to me, then at least you can just rest your eyes on the slides. So they will cover some of what I was planning to talk to you about. And the framing is absolutely perfect because you talked about how philanthropy and CSR and shared value are really along a continuum of different strategies that can be applied. So what I'm going to talk to you about is how Novo Nordisk has used what we call the triple bottom line as an expression of how we do business. So it really is how we do things around here. And the reason we do that and have done so for more than 20 years is that we see it as the way to be a sustainable business. And the way we define sustainable business is that we are here to serve patients whose needs are still not fully met. They are having to live their life with a chronic condition, whether it's diabetes or whether it's hemophilia or growth disorder, and they rely on us to be there for them for the rest of their life. So that's why we put this caption to be in business for the next generation as our definition of being a sustainable business. But of course, there's more to it than that, and I'm going to share with you a little bit about that. So I guess, Clarence, the comment you made about the CEO is this front cover of the Harvard Business Review in November last year. Behind that price tag is my CEO. His name is Lars Rebien Sørensen, and I think the layouters of the HBR thought that it could be a nice treat to say, you don't know this guy, but he happens to be the #1 CEO this year. Obviously, when I speak to my CEO about this cover, he says, but this is a strange cover because you cannot really see who I am. But the point that I want to use here is not so much to brag that our CEO is the #1, but really to put into context why. Because we all have all of these rankings. We're also fortunate enough to be on the Fortune 50 rank of the change makers. And here, the HBR changed their methodology. So what they included this year was so-called ESG factors, environmental, social, governance, dimensions of business performance. And so our CEO was #5 last year, and this year he moved to #1. So obviously I take credit for that because my job is to make sure that we use the triple bottom line and that we ingrain it. So my conclusion here is that the triple bottom line is a 20% of performance that made all the difference between good and great. So what is the triple bottom line? Well, in our case, it's the foundation for how we will create value and how we will stay successful. So it's a lens that we use to look at our business and the context in which we operate, to consider how can we be financially responsible, socially responsible, and environmentally responsible whenever we make decisions. And so when you use the word responsible, it also means you have to be responsible vis-a-vis somebody. So what you don't see in that symbol of the triple bottom line, but which is really, really strongly there, is the stakeholders of the company. Because the ones who can be affected by our decisions, whether it is to start a production in a community to create jobs, whether it's to provide medicines in areas where this is not usually available, or whether it has to do with our use of renewable energy, it all impacts people, communities, and the environment. So we have to consider that. The industry that Gary and I work in is notable for really protecting its intellectual property rights. But in this case, what I would argue is that having a triple bottom line approach to doing business is not patented. It's free for everyone to use, and there's no patent expiry date. And what we did was that our board decided to include this statement in the objects, in the bylaws of the company, the articles of association, to make sure that no matter who that CEO is in the corner office, no matter who is on the board, this is how we do business, to strive to conduct our activities in a way that is financially, environmentally, and socially responsible. So that's a very strong message to investors, to people wanting to do business with us, and of course also for people working with us. And the beauty of it is that it works both ways. So not only does it institutionalize how we do things so that we can build it into reward systems and performance metrics, etc., but it's also something that employees can use to hold their management accountable. So if a decision is made and somebody says, you know, is this really environmentally responsible? It's perfectly okay to challenge it. So that's a very strong tool, and it's one that we also use internally to assess at a unit level whether or not you are actually living the Novo Nordisk way, the philosophy that we have, and applying the triple bottom line in your activities. So that was my piece of the corporate religion. So let's just talk a little bit about how it pans out. So to be financially responsible, and I think that speaks also to the philanthropy and the CR, is about how we earn our money and how we spend our money. So it has to do with ethical business conduct as well as how money is spent for investment for the future. The social responsibility is vis-a-vis the patients. That's where we have the biggest impact, its employees and its communities. And on the environmental responsibility, it's about minimizing that default negative impact we have by using nature's resources. So that's a very simple way of illustrating it. And so coming from the United Nations this morning, we have built our philosophy on the definition by the Brundtland Commission that we have to meet the needs of the present without compromising the future and the ability of future generations to pursue their needs. So we built our business on a very strong conviction that we believe that in order to have long-term success, in order to stay in business, we need to have that triple bottom line approach. And this is one that our CEO is very adamant about. And we actually don't talk about non-financials. We talk much more about pre-financials. And I think that was something that was also heard this morning. So just to take you through what it means and how it applies to how we do business. So first of all, we believe fundamentally that a triple bottom line approach is good business. We also believe that sustainability matters because we believe that we rely on a healthy environment, society, and economy, and I can get back to that. And thirdly, that we can contribute. So let me just take them one by one. So this is our CEO pictured on the terrace of our headquarters. He has his office on the 5th floor. I'm on the 2nd. I'm making my way up, but it takes time. And I think what he expresses here is also quite crucial, because he says, this is not about me, this being the best CEO. It's not about me. It's about leading a team that has collective responsibility. And again, this is what the triple bottom line is doing for us. So whereas in the past we had Lisa Kingo, who was heading up this function and doing really excellently, it also meant that people were actually saying, but that's your business, so we can tend to our financial business and our R&D. So by having it now ingrained is a much stronger tool. Secondly, and this is just an evidence to say it does attract and motivate employees. I think you all probably can subscribe to that. Secondly, the fact that, yes, the 17 global goals, I think what I like about them is actually that when you have this emblem, they come full circle. So they do set direction, as you said, and they're a guidance. They're a little bit like a job description for any head of state and any CEO on what do we need to do to achieve that nirvana state of a sustainable development. So what can we do to help achieve the global goals? Well, as a healthcare company, good health and well-being is of course prominent. But if you do take a lens of looking at all of the 17 goals, you will find health ingrained in all of them. So the ones that we picked out is sustainable cities and communities, is climate action, responsible consumption, gender equality, reducing inequalities, and of course, as an instrument, partnerships for the goals. So I could talk for hours about this, I won't, but just say that when we talk about access to health, for instance, we know that this is not equally distributed. And this is where reducing inequalities is absolutely essential when you talk about achieving good health and well-being. So we, like many of the other companies that have taken a lead in this, have decided to choose some of the targets that they want to work with. And I think that's fine, but I would also emphasize that you actually have to look at the others and say, how can we fit ourselves into the picture when it comes to life on land, life underwater, peace and justice, etc. So it's not an a la carte menu. It really is the whole meal that you have to address. So just getting to metrics, and we can get into that a little bit further if we have time. We built on this insight of what we call the rule of halves, where we know that diabetes is a socioeconomic burden. It's a human burden as well. And we have a huge opportunity gap in achieving better outcomes for people who have diabetes. We have perfect medicines, but obviously they don't work, since only 6% globally achieve a life without complications. And so we have a role to play in this, you have a role to play, and in order to solve it, we need to mobilize the resources around all of this together. So I'll just skip to one slide to show how we try and measure. And this is a case study series we've done that we call Blueprint for Change, that we did in order to persuade investors that there is a good business case in this approach. And so the really recent one, and I've just pulled out a few graphs, so this is not a beautiful slide, but it's just showing some of the data that are coming out of the recent study from Algeria, a growth economy, one of the prioritized markets in Novo Nordisk's world. 40 million people, of whom 1.7 million have diabetes, but only 90,000 achieve a life without complications. That is a huge access issue. So what we've also seen, and this is where we've been able to model numbers by using the core model, is that if you can focus on early diagnosis and optimal treatment of diabetes, there will be better health and there will be cost benefits. So by having a graph like this one as a conversation starter when we meet with the Ministry of Health, this is extremely helpful because it's a way of showing that if you take the long perspective like we do, there is money to be saved, there are lives to be saved, And there's a lot of economic growth potential that can be leveraged if only we can get it right at an earlier point. So I will stop here before I get the signal and say that it's a true privilege to be here, and I hope that I have the opportunity to also have your reactions to what I shared with you.